Neonatal positioning in NICU. The neonatal positioning is part of the developmentally supportive care pioneered by NIDCAP. The NICU environment is not conducive to the development of infants, mostly premature. Exchanging the womb for the NICU at a time of rapid brain growth has a detrimental effects of the infant early development. Reminder, in the womb, all neonates are in the fetal position. Arms and legs flex, knees and elbows tuck, curved spine, head tucked forward in a snug and secure environment. As you see, these are some examples of positional devices from Zaki and Phillips. As noted from the two previous pictures, positional devices from Zaki and Phillips is not available in our department. So in this video, I am going to show the two types of improvised boundary for nesting that I usually make from the available resources we can find in our department, which is the blankets, some towels, and some linens, and plaster. So the two types that I usually do is the round shape and the U shape. First, I will do the round shape. So we have here a beautiful white blanket which we will fold to make a triangular shape, like so. After that one, from the tips of the triangle, you fold it again, and from the end you just try to roll it until you reach the middle. It's a perfect roll blanket. And we need one plaster just to keep the roll blanket in place, and try to stretch out both ends like so, and from the both ends you just put them together and another plaster to just keep them combined. So here we have our own round shape or the womb shape boundary. So I'm already half finished. I just need one linen to finish our boundary. So you place our linen, the square type linen, in a crosswise position like so, and put the boundary in the middle. There you are. So from the bottom of the boundary, take the end of the linen, fold it, and just tuck inside the boundary. You'll do the same on the sides, and also from the other side. We will tuck the linen from inside the boundary. As you can see, we are already finished. From the top, you will do the same. So this is our first boundary, the round womb shape. I usually use this one for small babies. So I'll just set this one aside, and we will make the other boundary, which is the U-shape boundary. Here, if we have a towel like this, you can use this one because it's very soft. But you can also use our white blanket. You just make it in a rolled blanket to take the shape of the U shape, and just the same as the womb shape, you just put a plaster to keep it together. So it's the easiest to do actually. Here we already have our U shape. We just need one more linen. So this U-shape boundary can be used for full term and preterm, but this one is better for large babies. So like I did, just put our U-shape boundary in the middle of the linen, And the same as our womb shape, from the tips of the linen, you just keep tucking it in inside the boundary, like so. From the sides, if you notice, I did not use too much plaster. So now we have a complete U shape. This is our U shape boundary. So it's finished. U shape and our womb shape. Thank you. Three types of positioning: supine, side-lying, and the prone position. The benefits of achieving good positioning: promotes improved rest, support optimal growth, helps to normalize neurobehavioral organization, hand-to-mouth coordination, increases sense of security and support through containment and decreases stress, makes infant calmer through containment, requiring less medication, and helps to gain weight. Essential tips in providing good positioning: use a suitable nest with good boundary, curl the baby when possible, position on a midline. Make sure baby can touch hands and mouth. When using containment, ensure freedom to move. Give the infant something to hold. In this video, I will show you how to do the three types of position using the Kaleo series positional devices. So here we have the snuggle. It's very nice and new. And here we have another, the bendy, which is a U shape. And we also have these small positional devices. As you can see, they are very soft and very manageable to use. So we are ready to do our first position, which is the supine position. So just prepare your snuggle. Make sure it is nice and intact. So here is our little darling. We will put our infant in the middle of the snuggle. Remember, gravity causes the limbs to flap on all sides, mostly with the preterm babies. So with our snuggles, if you can see, it is used for support. Put all feet tuck inside the snuggle. Make sure the knees are flexed. Keep the patient in the middle line position. Take time to reassure the baby. So the pros of this supine position is that you have clear visual monitor, especially of the respiratory rate. There is an easy access for any procedures that we want to do. So if you see, there is this bending that I'm using only in the head part for support. The supine position is not optional for oxygenation. So if you have any patient with the supplemental oxygen, like high flow or bubble CPAP, try to change the position of the baby to sideline. So as you can see, I'm trying to take the time to reassure him, to contain him. I gave him something to hold so it will make him calmer. If you saw the picture on the right side, it's another sample of our supine position. So now we will try to contain the baby. Avoid the frog position, especially with the preterms. As we all know, they have lack of muscle control, which causes all the limbs to flap on all sides, and in the end it will lead to muscle imbalance. So here now, our baby looks calmer. So now we will just try to fix the baby, tuck all the feet inside. As you can see in the upper part, there's another sample of our supine position. It's been an hour. The baby is sleeping in a supine position. So now we will put him in a side lying position. In this case, in the right side. So just do it gently. Rotate the baby, starting from the lower part to the head part. So as you can see, I'm just trying to rotate him slowly. So in this position, the gravity is very useful. There it is. Still all feet intact. The limbs in all midline. He is in a very C curved position, just like inside the womb. Try to put the hand and the mouth together. It helps in the coordination. And again, if you see, I'm just trying to give him something to hold. In this position, ventilation is best in the upper lungs. So just try to fix. As you see in the upper part, another type of sideline position. And just try to fix gently and contain our baby. And another picture sample of a sideline position on the right upper part. So here we are, finished. It didn't take time because he was already calmer. And another sample of our picture sideline position in the right upper part. Thank you. So here we are after an hour in our last third position, which is the prone position. So in this position, since we don't have these positional devices used for prone positioning, we just try to improvise something. In this part, the Kalea positional device, they have this, they use the small U shape. You can use that one. So here it supports the sternum and the rib cage. As you can see, I'm just trying to improvise. I'm combining the two small U shape. If you don't have this, you can do some rolled linen. Importantly, it should be from head to belly. So as you can see. So try to let the baby hug this prone positional device. So in this prone position, it's very optimal for oxygenation. So just try to roll the baby in a prone position, gently support the head. So in the prone position, it increases time in quiet sleep. He doesn't want to let go. So just try to support the head and keep the hands tucked forward near the mouth. Make sure that the legs are tucked inside and they are in the flex position. So prone position, less energy expenditure for the patient. As you can see, there's another picture of a prone position. So in this prone position, you have to have close monitoring, and remember to change the position of the head to right and left. As you can see in the left upper part, there's another sample of a prone position. So I'm just trying to tuck it in, and another sample of the prone position. So I'm just trying to tuck in our little darling inside. As you can see in the upper part picture, the legs are flexed. And there we are finished. So please don't forget to use some devices also like this, especially for our preterm. This our Neo mops and our neonatal cap. So little hands we save today could be the future of tomorrow. Thank you.